Press the bell icon on the YouTube app and never miss another update.
Coronaviruses primarily infect the upper respiratory and gastrointestinal tract of mammals and birds. Currently, there are 7 known strains of coronaviruses that infect humans. Coronaviruses are believed to cause a significant percentage of all common colds in human adults and children. What is coronavirus? The Wuhan, China, virus explained coronavirus symptoms. The viruses can make people sick, usually with a mild to moderate upper respiratory tract illness, similar to a common cold. Coronavirus symptoms include a runny nose, cough, sore throat, possibly a headache and maybe a fever, which can last for a couple of days. For those with a weakened immune system, the elderly and the very young, there's a chance the virus could cause a lower, and much more serious, respiratory tract illness like a pneumonia or bronchitis. There are a handful of human coronaviruses that are known to be deadly. Middle East respiratory syndrome, also known as the MERS virus, was first reported in the Middle East in 2012 and also causes respiratory problems, but those symptoms are much more severe. 3 to 4 out of every 10 patients infected with MERS died, according to the CDC. Severe acute respiratory syndrome, also known as SARS, is the other coronavirus that can cause more severe symptoms. First identified in the Guangdong province, in southern China, according to the WHO, it causes respiratory problems, but can also cause diarrhea, fatigue, shortness of breath, respiratory distress and kidney failure. Depending on the patient's age, the death rate with SARS ranged from 0 to 50% of the cases, with older people being the most vulnerable. The Wuhan coronavirus is currently thought to be more mild than SARS and MERS, and takes longer to develop symptoms. Patients to date have typically experienced a mild cough for a week followed by shortness of breath, causing them to visit the hospital, explains Peter Horby, Professor of Emerging Infectious Diseases and Global Health at the University of Oxford. So far, around 15% to 20% of cases have become severe, requiring, for example, ventilation.